Hello, my name is Alexandra, and Alexandra Rochelle, and I will be doing an assessment on the abdomen today. I have my patient here who's my mentor, and I've already asked for her consent, which she's given. I've washed my hands. I've provided privacy to my patient, and we are going to start. The first thing that we're going to do is do an inspection of my patient's stomach. And what we're going to be looking for, we're going to be looking for color. We're going to be looking at vascularity. We're going to looking for striae, lesions, rashes, symmetry of her stomach, the movement with respiration to see if she has any scars. We're going to be looking at the contour. We're going to be looking at the location of her umbilicus, aortic pulsation, and peristalsis waves. So, with the inspection, we want her stomach exposed. We're looking for, right now I'm looking at the color, and she has light brown coloring all over. There's no discoloration from what I can see. If there were purple coloring at her flank, it could be an indication of bleeding, internal bleeding. If her skin was yellow, it could be an indication of jaundice. If it's pale or tau, it could be an indication of ascites, which is abdominal swelling due to fluid increase in her stomach. The next thing that we're going to do is look at vascularity. We're going to look to see if there's any scattered fine veins that may be visible on her skin. And I don't see any scattered veins. If she had dilated veins, it could be indication of cirrhosis of the liver or obstruction of veins. So her skin looks normal. She doesn't have any, she has some striae, some stretch marks, but there's no lesions or rashes. Her stomach is symmetrical. Her umbilicus is at midline. And to check the contour, we want to look at her stomach at eye level, and her stomach could either be flat, it could be scaphoid, rounded, or distended. My patient's stomach is rounded. Flat is normal. Scaphoid can also be normal, but it could also be an indication of severe weight loss, or it could be an indication of severe weight loss, recent weight loss. If her stomach is distended, meaning if it's protruding out, that is not normal. There's 5 reasons why it could be protruding. It could be due to fat, or patient's obese. There's feces, or she may be pregnant. So I mean that's normal. But if she wasn't pregnant, it would not be normal if it was distended. She could have bloating or flatulence or fluid in her stomach. So, like I said before, her umbilicus is midline, which is what we want. We could look to see if it's inverted or protruding. There's inverted umbilicus is normal. Protruding could be a sign of hernia. We would have the patient, can you cough for me? To see if there's any, if it comes out when she coughs, and it did not. So she does not have a hernia. The next thing that we're going to look at is we're going to look at aortic pulsation. And we look at this in the epigastric region here to see if there's any light pulsation. And you may be able to see a light pulsation, which is fine, which is normal. The next thing is we're going to look at her stomach to see if there's any peristalsis waves. You should not see any peristalsis wave. This could be a sign, if you do see it, of intestinal wall obstruction. And as I'm looking at her stomach, I don't see that. The next thing that we do, so we're done with inspection. What we're gonna do now is we're gonna auscultate for bowel sounds and vascular sounds. With the bowel sounds, we're looking for clicks and gurgles. We should listen in each quadrant for about 1 minute minimum and up to 5 minutes. The type of sounds that we're looking for, like I said, for normal is gurgles and clicks. But if she has hyperactive sounds, it could be due to diarrhea or she may be hungry. So the other thing would be if it's hypoactive, it could be due to diminished motility of her bowels. And then if there's no sound at all, it could actually be a sign of an emergency, and so she would need to get checked out. She would need to get referred. So we're gonna first, again, listen to the bowel sounds. We're gonna use the diaphragm of our stethoscope to do this. Okay, we're gonna start in the lower right quadrant and move clockwise. Okay, so I did hear some gurgles in there, and my patient did tell me that she was hungry, so it sounded normal. I didn't have to really wait long to hear any sound, but like I said earlier, you should listen for at least 1 minute, and it could take up to 5 minutes to hear anything. The next thing that we're gonna do is listen to vascular sounds. We're gonna use the bell of our stethoscope to look starting at the aortic region. Then we're gonna go to the renal, the iliac, and then we're gonna listen in the femoral region. And we're using the bell to listen for bruit. Bruit is not normal. You should not hear it. So it could be a sign of aneurysm or renal stenosis. But we're gonna start right now with listening to the aortic region. And the bruit sounds are low-pitched murmur-like sounds. Okay. Okay, I did not hear any bruit, so that was normal. When you're listening to these sounds, you have to note if there's a sound, note the intensity, the pitch, and the frequency of the sounds. The next thing that we're gonna do is listen for splenic and liver rub friction rub, I'm sorry. We don't want to hear any friction rub, so that's not normal. We're gonna start in the splenic region, and then we're gonna start at on the liver to listen to liver rub sounds, and then we're gonna go to the splenic.